Welcome to our channel, Wellness Health. This informative video is about moving and handling in health and social care. Moving and handling essentially involves aiding individuals with mobility needs in a safe, effective, and respectful manner. It's a broad term that includes techniques such as using appropriate equipment and following correct procedures. The importance of this practice cannot be overstated. It impacts both the caregivers and the patients. For the caregivers, improper moving and handling techniques can lead to severe injuries like musculoskeletal disorders and hernias. For patients, it's about dignity, comfort, and safety. In essence, moving and handling is a delicate balance of meeting the patient's needs while ensuring the caregiver's health and safety. It's about creating an environment where both parties feel valued and protected. Now that we have an idea of what moving and handling entails, let's delve deeper into its components. Moving and handling isn't just about lifting and transferring patients. It involves a deep understanding of human anatomy and physiology. Diving into the science of moving and handling, we're essentially talking about the musculoskeletal system. This system, as some of you may know, is our body's framework. It consists of bones, muscles, cartilage, tendons, ligaments, joints, and other connective tissues. These components work in harmony to provide form, support, stability, and movement to our body. When we're assisting individuals with mobility needs, we're interacting directly with their musculoskeletal system. And here's where the science comes into play. A thorough understanding of the system can help us determine the safest and most effective ways to move patients. For instance, knowing that the spine isn't built for heavy lifting, but rather for stability and support, can be instrumental in preventing injuries. Research has shown that improper moving and handling techniques can lead to musculoskeletal disorders, such as back pain, muscle strains, and even hernias. These conditions not only affect the healthcare professionals, but can also compromise the safety and comfort of the patients they are assisting. Furthermore, the science of biomechanics, which studies the structure and function of biological systems using the methods of mechanics, plays a crucial role here. It helps us understand how forces exerted on the body during lifting or moving affect the musculoskeletal system. By applying principles of biomechanics, healthcare professionals can optimize their movements to reduce strain and prevent injury. So you see, the science behind moving and handling extends far beyond the basics of lifting and transferring. It's a complex interplay of anatomy, physiology, and biomechanics. It involves understanding the limitations and capabilities of the human body, and using this knowledge to ensure safe and effective patient care. Understanding the science behind moving and handling is the first step towards ensuring safety and efficiency in health and social care. Like any other physical activity, moving and handling in health and social care comes with its risks. Let's delve into some of the common injuries associated with moving and handling. Musculoskeletal disorders, or MSDs, are right at the top of the list. MSDs can range from general aches and pains to more serious conditions like chronic back pain or severe arthritis. These disorders usually result from awkward postures, repetitive movements, or applying excessive force. Imagine a caregiver lifting a patient multiple times a day. This repetitive strain on the body can lead to musculoskeletal disorders over time. Another potential risk is hernias. A hernia occurs when an organ or fatty tissue pushes through a weak spot in a surrounding muscle or connective tissue. In the context of moving and handling, this can occur when caregivers use incorrect lifting techniques or overexert themselves. For example, lifting a patient from a low position can put excessive strain on the abdomen, increasing the risk of developing a hernia. Scientific findings back up these concerns. A study published in the International Journal of Nursing Studies revealed that healthcare workers who regularly perform patient transfers are at a higher risk of developing MSDs. Another study in the Journal of Clinical Nursing found that incorrect lifting techniques are a significant factor in hernia development among healthcare workers. These risks highlight the importance of correct techniques and procedures in moving and handling. It's not just about getting the job done, but doing it in a way that minimizes harm to the caregiver and the patient. This involves using appropriate equipment, following correct procedures, and understanding the individual's mobility needs. Being aware of these risks is crucial in creating a safer environment for both caregivers and patients. So how can we mitigate these risks? The answer lies in using proper techniques. We now delve into the heart of the matter, the proper techniques in moving and handling. Understanding and implementing these techniques can be the difference between efficient and safe care or potential risk of injury. Firstly, understanding the mechanics of the human body is essential. Our bodies are not designed to bear excessive or awkwardly distributed weight. Hence, when lifting or moving someone, it's crucial to maintain good posture and use the strength of your legs rather than your back. This can significantly reduce the risk of musculoskeletal disorders. Another essential technique is the use of handling aids. These devices range from simple slide sheets to complex hoists. They are designed to distribute weight evenly and reduce the physical strain on the caregiver. However, their effectiveness is contingent on correct usage. It's like having a high-end sports car. It's not going to give you the best performance if you don't know how to drive it properly. Risk assessment is another vital technique. Before undertaking any moving and handling task, take a moment to assess the situation. Identify potential hazards, evaluate the individual's weight, mobility level, and cooperation. This assessment will guide you on the best approach and equipment to use. Remember, no two situations are the same, so a one-size-fits-all approach just doesn't cut it. Let's not forget communication. This is often overlooked but is just as important. Clear and empathetic communication with the individual being moved can ensure their comfort and cooperation, making the process smoother and safer. These techniques are not just theories, they are backed by scientific research. Studies have shown a significant reduction in caregiver injuries when these techniques are applied. For instance, a study published in the American Journal of Industrial Medicine found that the use of handling aids reduced the risk of back injuries by up to 50%. Proper techniques in moving and handling are a game changer. They not only prevent injuries but also promote efficiency in health and social care. The key is understanding these techniques, knowing when to apply them, and doing so correctly. With this knowledge, we can create a safer and more efficient environment in health and social care. Remember, it's not just about getting the job done, but doing it in a way that prioritizes safety and well-being for all involved. Training plays a pivotal role in ensuring safety and efficiency in moving and handling. When we think about moving and handling in health and social care, there's no underestimating the significance of training. It's the cornerstone of effective and safe practices. But why is training so essential? Well, let's break it down. Firstly, training provides caregivers with a sound understanding of the principles of movement. It equips them with knowledge about body mechanics and the science of movement. This foundational understanding allows them to apply proper techniques when assisting individuals with mobility needs. Secondly, training offers hands-on experience with various equipment commonly used in moving and handling. This includes hoists, slide sheets, and transfer belts, to name a few. Familiarity with these tools can greatly enhance a caregiver's efficiency and confidence while minimizing the risk of injury to both caregiver and the individual being assisted. Training also emphasizes the importance of conducting risk assessments. A well-trained caregiver will know how to evaluate an individual's mobility needs and the environment in which they're operating. This allows for the identification and mitigation of potential risks before they become actual problems. Now, let's talk science. Numerous studies have shown a direct correlation between training and a reduction in work-related injuries. A report published in the International Journal of Nursing Studies found that caregivers who received proper moving and handling training were significantly less likely to experience musculoskeletal disorders. Moreover, training isn't just beneficial for caregivers, it's also advantageous for the individuals they assist. When caregivers are trained in the correct moving and handling techniques, the individuals in their care are less likely to experience discomfort or injury during transfers and repositioning. So, to sum it up, training in moving and handling is not just about ticking a box for compliance. It's about equipping caregivers with the knowledge and skills they need to perform their duties safely and efficiently. It's about minimizing risks and enhancing the quality of care. Investing in training is investing in safety and efficiency. It's a must-have in health and social care. Employers have a crucial role to play in promoting safety and efficiency in moving and handling. The role of employers in this context is not a passive one. It's an active, ongoing commitment to ensuring the well-being of their employees and the people they care for. This responsibility extends far beyond simply providing the necessary equipment. It's about creating a culture of safety, where proper moving and handling techniques are the norm, not the exception. Employers are tasked with conducting thorough risk assessments. This is a vital process that identifies potential hazards and determines the safest way to carry out tasks. It's not just about ticking boxes, it's about proactive prevention. By identifying risks before they cause harm, employers are able to implement measures to reduce or eliminate these risks. But conducting risk assessments isn't enough on its own. These assessments must be paired with effective training programs. Training is the bridge that connects knowledge to practice. It's through training that employees learn the correct techniques for moving and handling, the use of specialized equipment, and how to respond in case of an emergency. And let's not forget, training isn't a one-time event. It's an ongoing process, adapting as risks change and new methods are introduced. Employers should ensure that their employees are provided with regular refresher courses to keep their knowledge and skills up to date. Furthermore, employers should foster an environment where employees feel comfortable expressing their concerns or suggestions. Open communication can lead to improvements in practices and better safety outcomes. After all, those on the front line are often best placed to identify potential hazards and suggest practical solutions. Finally, employers should lead by example. They should demonstrate a commitment to safety in everything they do, from the decisions they make to the behaviors they promote. This can influence the attitudes of their employees, fostering a culture where safety is prioritized. Employers are the backbone of safe and effective moving and handling. Their investment in risk assessment and training can make a world of difference. In conclusion, moving and handling is an integral part of health and social care. We've delved into the science behind it, revealing how a deep understanding of body mechanics can prevent injuries and promote efficient movement. We've also shed light on the risks involved, emphasizing the importance of using proper techniques to manage these risks effectively. Training has been highlighted as a crucial element, not just for mastering these techniques, but also for cultivating a mindset of safety and care. Lastly, we've underscored the role of employers in ensuring that all these elements are in place through risk assessments, provision of appropriate equipment, and continuous training. This knowledge is not only beneficial for healthcare professionals, but can also be applied by anyone involved in the care of individuals with mobility needs. By understanding and implementing these principles, we can all contribute to a safer and more caring environment. We hope you found this video helpful. If you did, please leave a comment below, and don't forget to subscribe to our channel for more informative videos like this one.